Just kind of hang out right behind the.
Sure. All right. Well, thank you very much, and thank you everybody for having me today. Okay, let me just get situated. Okay, we should be good to go. So again, my name is Patrick Bigaouette. I'm actually originally from Minnesota, and then I headed out east for medical school, completed psychiatric training up in New York City, and then decided mid-pandemic to move back to Minnesota to practice. So right now I work for Mayo Clinic Health System, and I work in their outpatient psychiatric services. So what I'm going to do today is talk a little bit about mental health, what we saw in COVID, and then take a look at kind of the state of mental health in Mankato and different services that are offered throughout our community. So a little bit of overview about what I'm going to talk about today. So again, the state of mental illness, recognizing mental illness, looking at what exactly do I mean when I say, mental illness, looking at barriers to care, how to seek care, and then a little bit about different treatment modalities. So first of all, why do we care? So these are stats that came out of the CDC. So more than 50% of people, so 1 in 2, will be diagnosed with a mental health issue at some point in their life, and then 1 in 5 within any given year. So about half of us will experience this as a problem at some point in our life. And then in 2020, about 12.2 million people, adults, seriously thought about suicide. So not only were they struggling with mental illness, but they seriously thought about taking their own life. So a significant problem in healthcare crisis in our country. And then looking at, from a disability perspective, how disabling is mental illness. It's not something that's seen, but it's something that we can objectively compare to other medical illnesses. So if you look at the stats, second from the top, depression, anxiety, and emotional problems constitute the second most common reason for adults in our country to be on disability. So really prevalent and then very disabling disease that many people are struggling with. So why do we care? From an individual perspective, why do we care? Well, mental health is our sense of self. It's our well-being. It's our emotional or psychological or social states, but it really impacts how we feel about ourselves and how we relate to other people, how productive we are as members of our society in our work, and then our relationship with others. It also impacts our physical health, and then can also lead to things like substance use, if not adequately controlled. So recognizing mental illness. So we can say, yes, we have a mental health crisis, we have a mental health problem, but what does that look like? And mental health is a little bit different than something like a broken leg that you can easily see, right? If somebody's arm is broken, you can definitely see that that's happening, and the solution is you fix the broken arm and you cast it and you move on. Mental health is a little bit more challenging than that, right? Because what is depression? It's more than just feeling sad. Depression looks different for every single person. And I listed up on the screen different ways that can manifest for people. So that can be, I feel sad or I feel depressed, but it could be, I'm apathetic, or I have kind of a loss of interest in doing things, or it can be simply I'm having a really hard time getting up for the day and going to work or doing those things that I typically enjoy. That can be feeling emotionless, so not feeling depressed, but not having really emotions or joy for things that I typically do. That can be hopelessness. That can look like insomnia, difficulties with appetite. So it's more than I feel depressed or I feel sad. And I think it's important to note that your experience of what you think depression should be or how you experience it isn't necessarily how other people are experiencing depression. So just because some people doesn't look depressed or doesn't seem sad or depressed, doesn't mean that they aren't really struggling. I think that's the huge challenge that we have, and why those numbers are so shocking when it says 12.2 million people have thought about killing themselves in the last year. That's the same thing with anxiety or any other mental illness. So anxiety is more than I have anxiety or I feel anxious. That can look like uncertainty. That can look like restlessness, feeling overwhelmed with what's going on up here, that you can't sit still, that you can't concentrate, that you can't focus on your work or what you should be doing during the day. That can look like trouble sleeping, insomnia. I have such a hard time turning off my brain at the end of the day that I can't fall asleep because it's constantly going and going and going. It's more than I feel anxious. So this is depression, this is anxiety, but that constitutes all mental illness. So that can look like psychosis, that can look like mania. All of these illnesses that we talk about manifest so differently person to person. So brain-body axis. So I like to include this slide because I think it's important to note that there's a correlation between how we feel mentally and how we feel physically. And so a lot of times anxiety can manifest with physical symptoms, much like depression can manifest with physical symptoms. And the problem with that is sometimes people get into the cyclical state of their mental health is worsening their physical symptoms, and then their physical symptoms are worsening their mental health. So a good example of this that I think a lot of people can relate to is anxiety, right? So if you have ever experienced a panic attack or know somebody who has, people in a panicked state feel highly anxious. They feel like they're having a heart attack, like they're going to die. They feel short of breath. They have heart palpitations. So it manifests really physically. That happens with other psychiatric illnesses too. People with generalized anxiety struggle a lot more with chronic pain because they're holding themselves very tensely. So there's a huge overlap between the two. And then when people are holding themselves tensely, they are more likely to struggle with pain, right? And the people that are struggling with chronic pain are more likely to feel anxious or feel depressed. And so you get stuck in this loop of one causing the other. And it's really hard to sometimes break that loop or have that recognition. I included these two terms up here, pseudo-seizures and conversion disorder, to kind of show that for some people, their anxiety or their depression can be so significant that it looks like people are having really unusual neurological symptoms or pseudo-seizures. And it's because their brain is so overwhelmed with anxiety that it appears they're having a seizure when they may not be. So really significant overlap between these two things. Mental health in the workplace. So why was it important during the pandemic and why is it important after the pandemic? So the big thing that we learned throughout the pandemic is that number one, we have a mental health crisis in our country. Rates of depression, anxiety increased by 20% during the pandemic. And some of that is, we were in our own homes and we didn't have that regular schedule, but some of that was the actual manifestations from the pandemic. So constantly needing to kind of readapt to things that were evolving. So chronically trying to manage new expectations, manage the change with the pandemic, having that uncertainty, constantly needing to adapt, but then still have this high level of productivity. So we saw that in our workplaces, we saw that in schools with kids, right? So it's this kind of constant change and never feeling comfortable that was really driving a lot of burnout for people, but then also depression and anxiety. So burnout's important in the pandemic and after the pandemic because it decreases our quality of work. It decreases our satisfaction in our job and in our life. If we're not happy with our job or what's going on in our life, we have decreased productivity. That leads to increased employee turnover because if you're not happy, you're not going to stay. Burnout can lead to depression, it can lead to anxiety, and then for some people, it can lead to substance use. If I'm really struggling to cope with difficult emotions and I'm not really addressing those, a lot of people will turn to things like alcohol to kind of bring down that level of distress or anxiety at the end of the day. So what can we do? So I think this topic comes up a lot. What can we do with the mental health crisis, right? We're all sort of aware that there is one. We hear it a lot in the news, we hear a lot in the media, but what do we actually do? And I think before we get to that, it's important to talk about the barriers of care because, if we know what to do, who cares if people aren't able to access it, then what's the point of talking about it? So the big barriers that I frequently see are recognition of need to seek services. So part of that is recognizing what is mental illness and looking at it and seeing that it can look different person to person, getting over the stigma related to mental illness, and then also access to care. And I'll talk about these three things a little bit, but to break down access and care, that can be literal access, so number of clinicians that are in our area who are accepting patients. That can be time, right? Because a lot of outpatient clinics are open 9 to 5, and we're also working 9 to 5. That can be money, our healthcare system. It costs a lot of money to see doctors, and even with insurance, that we still get bills that are high and not manageable for most families. And then also looking at quality. So recognizing mental illness. So this isn't anything that's new. I put this at the beginning of my talk that depression, anxiety looks different for everybody, right? And just because somebody doesn't appear depressed or somebody is saying I'm really struggling, but they don't look like they're struggling, and so you don't believe them, it's not the case because their experience of what they're going through is not the same as your experience. Everybody is so different in how they cope with what's happening and how they cope with their internal state. So number one is, in terms of barriers, is recognizing that mental health looks different from person to person and that experiences are different. So when you realize that, yes, I'm really struggling with depression, or yes, I'm really struggling with anxiety, now what do I do? So it's looking at yourself, what can I do in my own environment to help with what is going on? So some of that is our own behavior patterns. So looking at things like the news. I will have people that come in that are really struggling with the state affairs, right? And they're watching a lot of the news. So are you watching the news to stay informed, or are you kind of excessively watching the news, ruminating on what is going on in the news, and then letting that dictate everything else that's going on in your life? So looking at our own behavior patterns, looking at our own structure and schedule. So making sure that we are sleeping, that we're eating adequately, that we're having that physical activity. A lot of times our ways to cope with stress is really to isolate and close off and close everything out. But if we're not able to maintain that sleep schedule, the nutrition, the physical activity, everything else sort of falls apart. And a lot of times people will come in and say, yes, I am doing that, Monday through Friday, but then the weekend comes and I don't have to work on Saturday, so I stay up until 2 a.m., right? Or, it's Friday, so I'm gonna have a couple of drinks and stay out late. And that sort of dysregulates your whole schedule that you've worked really hard for that Monday through Friday. Really looking at substance use, am I addressing the stressors in my life, or am I coping by utilizing alcohol? Looking at connectedness, so am I pulling away, or am I really staying connected with the people in my life that I care about? So my friends, my family, and really reaching out when I need that help. But then from an organizational level or from a work level, right? So am I burnt out at work and isolating and not talking to anybody about it? Or am I really staying connected with the people that I work with and my boss to really address, hey, this is a problem that I'm really experiencing with. I'm really having a hard time adjusting or adapting. What can we do, or how, what can we do to make my job more enjoyable to come into, or make my job something that I'm happy to get up and go to during the day? And then looking at mindfulness. Mindfulness is something that we can do at home, and I'll talk about a little bit about that later. So burnout in the workplace. So how do we help with that? So one is that connectedness that I was talking about. So reaching out to the people that you work with, reaching out to your boss, but then looking at your job and looking at, is what I'm doing providing me purpose? What purpose am I getting out of my job? Am I going just to go and mindlessly being there, or do I have a specific purpose that I get out of my job? Looking at autonomy. So in my job, am I sort of micromanaged with everything that I do, or do I have some autonomy to have growth, explore things that give me purpose, and not feeling kind of boxed into a corner? Looking at that growth. So am I going to be static in this one place, or are there areas that I can grow? Are there areas that I can change? Are there areas that I can seek purpose and autonomy in my job? Looking at environmental mastery. So yes, I want to have growth in my job, but also I want to be good at what I do before I need to adapt and change to something completely different. And then again, looking at the positive relationships and looking at the connectedness that you have with your coworkers and your employer. And then also practicing self-acceptance. So there are things that are in your control, right? Something that's in your control is that connectedness. And there are some things that are not in your control. No matter what you do or think or say, it will not change. And sort of trying to accept the things that are out of your control. So reducing stigma. So the second barrier that I had listed is, recognizing mental health, but then also reducing stigma. And I think this is evolving over time because we are talking about it more. We're seeing it more in the media. And how to reduce stigma? So having open dialogue, having communication, having awareness. So having events like this, acknowledging that, yes, this is a huge crisis in our country. This is a huge crisis in Mankato, and having open dialogues, communication, awareness of how do we address this huge problem that we have, and providing that education in doing so. But then also decreasing the gap between physical illness and mental illness, right? We take a broken arm very seriously, right? But we may not always take people who are struggling with anxiety or depression seriously because we cannot see it the way that we can see a broken arm. And then having compassion and understanding, right? So a lot of times when somebody's struggling with depression and anxiety over and over and over again, that compassion seems to drop off, or that understanding seems to drop off, right? In ways that it doesn't for things like medical illness. So if you think about like asthma or COPD, that's something that's recurrent and episodic, and we still have that compassion for somebody in an asthma attack who can't breathe, right? You feel really bad for them. But a lot of times when people struggle with anxiety, that tends to go away because that person is viewed as seeking attention, right? Or not trying to help themselves. And so that compassionate understanding decreases because it's something that's not as objective or physical as medical illness. So that's ways that we can reduce stigma. So my screen is cut off a little bit here, but looking at improving access. So improving access from a national perspective, but then also from a local perspective as well. So this is where the pandemic comes in. Because prior to COVID, not a lot of practitioners were utilizing telepsychiatry services. And the pandemic, for all this bad effects from that, the telepsychiatry is a good effect of COVID because it forced a lot of companies and individuals to push forward in terms of technology and how do we offer services with the technology that we have. And this is really important for places like Mankato and the surrounding areas because it improves access drastically. So I can see a psychiatrist now in Minneapolis or Duluth or other big cities where they may have more providers, whereas Mankato, we may not have as many providers. So it increases access, it increases our freedom of choice. So do I need a specialist psychiatrist who sees healthcare professionals, right? There isn't a psychiatrist in Mankato who specializes in seeing doctors, but there may be one in Minneapolis. And that translates to other areas as well. So, my kiddo was really struggling with something related to hockey and performance related to their hockey, and there are providers that specialize in that. Is there somebody in Mankato? I'm not sure, but the odds of some provider specializing in that area in Minneapolis is much higher. So it increases access, it increases freedom of choice, really tailoring to your specific needs, and then allows us to look at severity of symptomatology. So, if somebody in Mankato is really struggling with treatment-resistant depression and needs ketamine or TMS or electroconvulsive therapy, they can have a teleservice appointment in Minneapolis or Rochester for somebody who's offering those services. The other thing that the pandemic did is it increased technology related to apps and websites. So there was an explosion of different startups and companies that are offering psychiatric services. So increasing, again, our freedom of choice, but then also access. And then at the bottom, looking at crisis resources from a national perspective. So 20% increase in depression and anxiety, our legislators responded to that by saying, listen, our suicide prevention hotline number is 11 digits or 10 digits long, 1-800, all those numbers after that nobody can remember. If somebody is in crisis, how do we expect somebody to remember that? I work in mental health care and I don't know beyond that 1-800, right? And so they said, we had 911, that's easy to remember. Can we model a crisis number after that? And they said, yes, 988. So that started in June or July of this year, where now our patients can call 988 instead of needing to remember that very long number. So that was also a manifestation of COVID in response to those increased numbers. So if you narrowed it down to Mankato, what are the resources that we have in our area? So in my personal life, when somebody is struggling, they're like, where do I start? What is out there? This is kind of the big spectrum of what's available in Mankato. And how I listed them is from kind of more intense services all the way down to less intense. So we have inpatient psychiatric services in Mankato. Mayo Clinic has a 11-bed unit for inpatient patients. So people that are really struggling with acute suicidality, acute mania, acute psychosis, that need that kind of locked unit 24/7 care and support. In our area, we also have crisis services. So we have a crisis center where you can go and you can stay there. And so you have a 24-hour support, but you're not necessarily confined to the rules and regulations of being on an inpatient unit. Our area also offers residential treatment services. So again, you're staying at a place, you're getting that 24-hour care, you're getting intensive services every single day. But again, you're not having that constriction of being locked on an inpatient psychiatric unit. Our area also offers intensive outpatient services. So you're still getting intensive services like you do in a residential treatment, but you're staying in your own home. So you're getting intensive care, but you're allowed to go home at the end of the day. And so it's kind of stepping back from living somewhere else and having that 24/7 support. And then a step down from that is outpatient services. So looking at seeing a therapist once a week or once a month, or seeing a psychiatrist once a month. So not having that, every single day I'm getting psychiatric services, I'm seeing somebody once a week or once a month. So in Mankato, we actually kind of run the full gambit from kind of standard outpatient all the way up to intensive and residential and inpatient services. So that's one advantage that we do have in Mankato. Looking at new frontiers. So I include this not related to the pandemic, but just, what's out there? Is psychiatry changing at all? And the answer is yes. For a long time, we didn't have any new mechanism of actions for medications to treat depression and anxiety. But with new technology, we're starting to look at people's genetics. So in individualizing their psychiatric services. So we're looking at how do you process medications from a metabolism standpoint, but then also looking at specific genetic markers to really tailor what specific medications that you're on. Looking at new mechanisms. So in the last 3-4 years, there's been medications that have come out every single year that have a new mechanism on how they're working. And so there's people that have been previously treatment resistant who are really responding well to these newer medications. And then looking at interventional approaches. So ECT people have probably heard about, and it's sort of portrayed dramatically in movies, but so electroconvulsive therapy has refined over time. It's not the dramatic seizures that you see in older movies, but it is really localized and safe and effective. And then more recently looking at transcranial magnetic stimulation. So stimulating a part of the brain to target depression, anxiety. And then ketamine in the last couple of years has sort of exploded across the country. And that is a new medication where it is intranasally or an IV infusion, and it rapidly reduces depression and suicidality. So looking at these interventional approaches, that is a big area of Mankato that we do lack, unfortunately, is the interventional approaches. So a lot of times people that are presenting that are needing these services need to go to either Rochester or the cities. So how much time do I have? 10-2. Okay, so a lot of times when I'm not at work, right, I have family members or friends that will reach out all the time and they say, I don't know where to start, or they have a financial concern in regards to accessing care. And so here's what I tell them. First, go to Psychology Today, particularly if it's an access of care issue. Psychology Today is a website, and this is a screen grab from their website with a very happy looking woman winking for some reason. But it allows you to search for providers. So this is therapists and psychiatrists by location, your type of insurance, and then the type of psychotherapy. So I'll direct friends, families to this website because it'll give you a list of all the providers in your area, and then give you a list of their bios and sort of reading about them and who they are and seeing who you relate well to. So this is how I direct people into seeking their own services. If it's a financial concern in accessing care, right, so I don't have any money at all, right? Or I have very little, or I'm very overwhelmed by the thought of trying to deal with my insurance, or I don't want to deal with my insurance because there is that stigma that's still out there. What do I do? There's a lot of really great free resources. One is mindfulness, which I had mentioned earlier, and then cognitive behavioral therapy. And both of these treatment modalities, they're technically therapy modalities, but there's a lot of websites, workbooks, and then a lot of great YouTube channels that utilize these two treatment modalities. And so I think for time, I'll just breeze through them so I can have a few minutes for questions. But mindfulness basically is a type of meditation. And what it's really looking at is kind of bringing you back to the here and now and being present in the moment, right? And really looking at what is going on with my body and my mind and kind of recentering so that you can be here rather than focusing externally kind of on everything else that's going on around you. So it's kind of recentering yourself. And there's a lot of great YouTube channels in particular that do guided mindfulness. So kind of walking you through that process and how to do it. So there's a couple different types, and then the guided mindfulness. And so I can send these slides out later, but the other treatment modality that is free and has a lot of resources out there is cognitive behavioral therapy. So this therapy is not new, it's been around for a long time, and then has a lot of great evidence across psychiatric illnesses. So depression, anxiety, personality disorder, psychosis, everything. Shown CBT is highly effective. And what it's really looking at is our automatic thoughts and how those automatic thoughts impact how we feel and then how we behave. And so looking at our cognitive distortions, right? So we don't perceive things accurately all the time. And based on that, we do have maladaptive behaviors. So cognitive distortion, so catastrophizing, right? So, this talk is going to be the worst talk ever and I'm going to be horrible at it, right? The kind of the worst case scenario, and that will drive a lot of anxiety for me. And then that anxiety is going to cause me to, tank this lecture, right? So catastrophizing, looking at overgeneralization. So I've had a really bad experience in the past with public speaking or lecturing. And so therefore I will always have a horrible experience, right? So our minds can play tricks on us. Emotional reasoning. So I feel like this talk is going really horribly and therefore it definitely is, right? Whether it is or not, right? I can convince myself into it, and then that drives a lot of anxiety for me. And then what happens when people are highly anxious, you can go into a panic attack, your mind can kind of shut down and you've kind of predicted, right, what is already going to happen, right? So our minds play all of these tricks on us, and CBT is really looking at how to correct the thought process between those automatic thoughts, our emotions, and then our behaviors that are associated with that. So mindfulness CBT is what have people look at when there's financial concerns. There's applications, there's workbooks, there's YouTube channels that are really great and kind of walking people through that process. So this is the last slide. I'll leave this up for the resources that are in our community, and then I'm more than happy to take questions. So hand immediately shot up in the back, green.
It's been in my mind since you even said what you're talking about. So it feels like for us at least,
Yep.
as a small business, but we have about 80 employees and a lot of them are very young. It feels as though we might be doing a lot more therapy than we are managing at some points.
Mm-hmm.
Do you feel any shift with small business or large business employers where they might have like a therapy on site or therapist on site or somebody to help you?
Maybe. There are companies that do that. I will say it can, logistically, it becomes quite difficult. And then a lot of people also would not go to therapists at their employer because they are worried about what is going to be said there. So in my opinion, you want a therapist that you're really open and comfortable with and can be objective. And if I were going to a therapist at my employer, I feel like I couldn't do that. And then the therapy wouldn't be as effective. So I could see it going both ways. Yeah. Not a very satisfying answer, I'm assuming. Yeah.
What about shortage of professionals?
Yeah, shortage of professionals. And then so yes, a ton of rural areas are really struggling with that. And that was the big advantage of COVID, is that we have these teleservices now. So struggles with providers in our area, we can look at Psychology Today, and what I have people do is put in a zip code in Chaska or put in a zip code in Eden Prairie, and they'll increase the number of providers that are available. And then a lot of them are offering those teleservices. So you're able to see a psychiatrist who can make, say, medication recommendations for you to get you started. And then your primary care doctor can continue those meds for you. So it's one way to increase, or, while not ideal, doing therapy through video visits. It's a huge option as well. I think you had one.
Can you give some helpful tips on having, if somebody you would expect is showing signs of depression or anxiety, how to get them to help they need?
Yeah, so that's what can be tough, right? So number one is just letting them know that you're there, right? And that you're an open ear and that you're willing to listen and be non-judgmental with that, right? And so a lot of that feels like it's implied, but when somebody's struggling with depression and anxiety, they have all these distorted thoughts that may not be accurate, right? So really being there and allowing them to know, hey, I'm here for you. I am not going to judge anything that's going on, right? I want to be helpful. How can I help you, right? And sometimes they may tell you, and if they don't, you can say, hey, I know of all these options that are available in our community. Like, do you want to talk to somebody, right? Or would you be willing to talk to somebody? And so kind of opening that door, allowing them to feel comfortable, right? And then putting it into their I'm horrible with sports references, but their end of the court, right? So that they can respond to that. Right? A lot of times if people feel pressured, they're kind of close off completely, right? So opening that door, being non-judgmental, and then having these options available. Yeah. Back there.
Yeah, could you, if someone feels the need to call 911 or what happens on the other end?
It really depends on why they're calling. So sometimes people are calling just because they need to speak with somebody, right, to bring down that level of crisis or whatever is happening. And sometimes it's just giving that therapeutic support. Hey, I'm here and I'm listening, right? And I'm not judging, right? What do you need to talk to? What do you need to get off your chest to bring down that level of crisis? Sometimes that's how that goes. Sometimes it's, I'm suicidal and I have plans and I'm going to do something and I need help and I don't know where to go. And they can walk through kind of these different options and where they're living. And sometimes it may be a little bit less acute, right? Where I'm really, really struggling and I need to speak with somebody about, is this normal for anxiety? Is this normal for depression? Is this normal for the human experience, right? And if not, seeking services and what those services can look like. A lot of times people don't know where to start, right? And so the 988 number is kind of a good starting point or jumping point. Kind of runs like a huge gambit.
So it's not always, it's not always used as an emergency situation.
Not always, no. Yeah.
The crisis center, the box facility that people will go to, do you feel that, has enough room for people in crisis, or do you see that you're having to turn people away that need help?
We don't have enough room for people in crisis, and that is not a Mankato specific problem, that's a statewide problem. Unfortunately, frequently people will come in and there won't be any beds available anywhere in the state. So it's definitely a national problem, a Minnesota problem, and then a Mankato problem. On the flip side, we are lucky enough where, we do have an inpatient unit where some communities do not. And then we do have these other crisis centers, the residential treatment, where it may not be ideal, right? But it's better than sending somebody home where they don't have that support that they need. So.
A question from somebody at home. How does this situation get complicated when it's a young person or youth who are the people you're trying to help?
Yeah, so a little bit vague. Could you help me understand that a little bit? Like if they don't want services or you're not sure how to breach the
I
subject?
really doesn't say just talking about when talking about mental health for
How
you.
does this change? So it changes pretty significantly. In full disclosure, I'm an adult psychiatrist, not child adolescent. But you get into dynamic difficulties, right? Because what the parents may want or parents' viewpoint may not be accurate as to what the child is experiencing or what the child wants. The best thing, again, is to group all of the parties involved, so getting engaged with the child and the adult to really have an open discussion of what is happening, right? So that you can all also sort of all be on the same page, but then also meeting or talking with the kid individually, because there is a lot of stuff that they do not feel comfortable talking with their parents about. So making sure that the family, the parent, the guardian is involved, right? But then also hearing the kid individually as well. So it's kind of that hard teeter-totter balance between those two things. Yeah.
Do you have any kind of a connection with, say, MSU or District 77?
Connection, how so? Connection, how so?
But do you have any kind of a relationship with it where you get people referred to you?
Yeah, so we get people referred all of the time to us from the schools, and then we work with them a lot as well, particularly if somebody is significant enough where they're ending up on our inpatient units or really having kind of the crisis, we'll work with the schools a lot. But then also if whatever they're struggling with is related to their school or their environment at school, then we'll work with the staff there as well. Some of it depends on how comfortable the students feel, to be honest, particularly if they're coming from the colleges and what they want disclosed, what they don't want disclosed. But yeah, we get a lot of referrals from the schools. All right, well, thank you very much.
Thank you. There's always more to that subject than we have time to discuss, but I've been informed